Hello everyone. In this video, we will talk about pulp vitality test. But before we start, it is very important that we should keep this in mind that the diagnosis of the dental pulp status should be seen as a synthesis of history, proper clinical examination, and not just as an outcome of any one specific test. So, when do we need pulp testing? What are the key uses of pulp testing in clinical practices? Prior to any operative procedures and also before any orthodontic intervention, as a pulpal degeneration can occur without accompanying symptoms. For diagnosis of pain, for investigation of the radiolucent area to check for the differential diagnosis of the pulpal pathology, in cases of trauma, for the assessment of the traumatic teeth, for the assessment of the pulpal vitality. So these are broadly categorized as a sensibility test and the test to evaluate the tooth vasculature. So what does the word the sensibility means? The sensibility is defined as the ability to respond to a stimulus, and hence this is an accurate and appropriate term that we typically and commonly use in the clinical practices, that like these tests, like this thermal test and the EPT or the electric pulp tester. Under thermal test we have the cold test and the heat test, and this test to evaluate the tooth vasculature, this include the Laser Doppler Flowmetry and the Pulse Oximetry. So the sensibility test, basically here they determine the inactness of the dental pulp nerves. So if the pulp responds to a stimulus, then clinician assume that the pulp has the innervation, and the status of the pulp may be either healthy, it may be either inflamed or necrosed. But the vitality of the pulp is determined by the inactness and the health of the vascular supply, and not the status of the pulp nerve fibers. So these tests are more reliable, or actually these are the tests to evaluate the pulp vitality. So before we move on, let's clear these two terms, the sensitivity and the specificity. Many a times we came across the sentence saying like the sensitivity of the cold test is about 0.83. What does this mean? The sensitivity is basically the ability of a test to identify the teeth that are diseased. So if it says that the cold test has a sensibility of 0.83, it means that the cold test correctly identified 83% of the teeth that had a necrotic pulp. And now what does this specificity means? The specificity relates to the ability of a test to identify the teeth without the disease. So I hope these two terms are clear. So moving ahead, we have the thermal test. So in this thermal test, there is application of either cold or heat stimuli to a tooth to determine the sensitivity to thermal changes. So first test that we are going to discuss is the cold test. The cold test can be performed either with the frozen carbon dioxide snow or the dry ice, the refrigerant spray, the endofrost, dichloro-difluoromethane, ethyl chloride. From where do we start this cold test? This cold test should be started from the posterior most teeth, and we should advance in the anterior teeth. Otherwise, we can drip off the ice water in the posterior area, which can affect our result. So what is the mechanism that occur in this cold test? What happens when we apply cold stimulus to teeth? So whenever we apply any cold stimulus to a teeth, it causes actually the contraction of the dentinal fluids within the dentinal tubules. So that results in a rapid outward movement of the fluid within the dentinal tubules. And this rapid movement of the dentinal fluid will result in a hydrodynamic forces that acts on the A delta nerve fibers. That leads to a sharp sensation that can last for a duration of a thermal test. So this is the mechanism that occurs when we apply any cold stimulus to a teeth. Ideally, the cold testing should be used in conjunction with an electric pulp tester so that the result from one test will verify the findings of the other test. And also, this cold test may be used to differentiate between the reversible and the irreversible pulpitis. Like if you remove the stimulus and the pain still persists, then obviously the pulp has when the status of the pulp has undergone into a irreversible pulpitis, and and as soon as we remove the stimulus, the pain do not remain there, then in that case it is reversible pulpitis. So this cold test basically it usually indicates a vital pulp regardless of whether the pulp is normal or abnormal. And whereas this cold test, whereas this heat test is suggestive of the pulpal or periapical pathology that may require the endodontic intervention. So now coming on to the heat test, it can be done using a stick of heated gutta percha, using a hot water which can be administered through an irrigating syringe. And before applying any of these things, we should coat the teeth with Vaseline or other things to prevent it from the damage, and excessive heating can result from the pulpal damage. And also these tests are difficult to perform in the posterior teeth. This heat test is most useful in the cases when the patient comes in the clinic and he says that I am having severe dental pain upon contact with any hot liquid or any food. So that teeth will exhibit an immediate intense pain when it is tested with the heat. Even a delayed response can occur. So before moving on to another teeth, we should at least wait for 10 seconds. That will allow the sufficient time for onset of any symptoms. So the next test is the electric pulp test. It comprises of a it is a handheld device, and it comprises of a probe tip. It has got a digital display. The testing probe is placed at the incisal third of anterior teeth and the middle third of the posterior teeth. These areas are selected because the density of the nerve is more in these places. So the probe is placed in that area, and we apply a good conducting medium in this testing probe, and in certain cases we have a lip clip to complete the whole circuit, or if the patient touches, the circuits get completed. So this is all the mechanism that the electric pulp test uses. And in cases where we have the complete coverage crown, what we can do a bridging technique. So what we do in this, we place a tip of the probe in the exposed area, and we apply a conducting medium over the tip of the probe, and over this we place the probe tip with a suitable conducting medium, and the electric pulp test can be performed in this way, in this bridging way. Correct. So what is this? What is the actual mechanism of working in this electric pulp test? So the objective of EPT is to stimulate the intact A delta nerves in the pulp dentin complex by applying the electric current onto the tooth surface. The positive result comes from the ionic shift in the dentinal fluids within the tubules that causes the local depolarization and this local depolarization will subsequently generate the action potential from the intact A delta nerve fibers. So to simplify, basically these electric pulp tests denotes that some of the viable nerve fibers are present in the pulp and they are capable of responding. So they stimulate the intact A delta nerve fibers in the pulp dentin complex by applying an electric current on the tooth surface, and they donate that some of the viable nerve fibers are present in the pulp and these are capable of responding. In certain cases, these APT give false positive, and where we have this false positive in case of the NSYS patient, where we have the liquefaction necrosis in contact with metal restoration, where we have the vital tooth tissue present, and in false negative in cases where there is incomplete root development, recently traumatized teeth, sclerosed canal, and in recent orthodontic activation. Coming on to the test to evaluate the tooth vasculature. So we have the Laser Doppler Flowmetry. So it is a non-invasive technique. Its use in teeth was first described by Zelius and his co-worker. It is so as we have discussed, it is a non-invasive method for assessing the blood flow in the microvascular system, and this technique utilizes a beam of infrared light produced by a laser, and it is directed into a tissue, and as the light enters the tissue, it is scattered and absorbed by the moving red blood cells and the stationary tissue elements. So what happens in that case? Photons that interact with the moving red blood cells are scattered and frequency shifted as per the Doppler principle. But photons that interact with the stationary elements are not Doppler shifted. So a portion of light is returned to the photon detector and a signal is produced by the Doppler shifted photons. So but still how they test the pulp vasculature? The question here again comes. So because the RBC contribute to the maximum number of the moving object in the pulp, so measurement of the Doppler shifted backscattered light is interpreted as an index of the pulpal blood flow. It has got certain advantages like it is extremely accurate in predicting revascularization status and to assess the trauma, but has got certain limitation like the motion artifact due to uncontrolled movement of the probe when it is placed over the tooth, and the blood pigments within the discolored tooth crown can also interfere with the laser light transmission. Next is the Pulse Oximetry. It is an oxygen saturation monitoring device. It consists of two light-emitting diodes, one to transmit red light and other to transmit infrared light. So the phenomenon basically behind this is that the oxygenated and deoxygenated hemoglobin absorbs different amount of red or infrared lights, and the pulsatile change in the blood volume causes the periodic changes in the amount of red or infrared light absorbed by the vascular bed before the photo detection. And the pulsatile change in absorption here is basically used to determine the oxygen saturation. Correct. And but still this pulp oximeter don't have a predictable diagnostic value as a sensor size and shape should conform to the anatomy of the tooth that we are using, and also in cases where we have the coronal calcification, in that case also the result may vary. So this is all about the pulp oximetry and about all the pulp tests that we use. So I hope this helps. Thank you.